Ian Watson, known as Blueberry, is a 78-year-old male who was admitted here from a long-term care facility after being diagnosed with influenza A during an outbreak there. This illness has worsened his existing conditions and caused him quite a bit of anxiety. His history includes hypertension, stage 3 chronic kidney disease, and a past prostate cancer surgery. He's had multiple falls over the past year, which led to his admission to the facility. Ian's a full code and has a documented allergy to morphine, which causes him hives. Right now, he's on Tamiflu for the flu and is taking acetaminophen as needed for fever and pain. His regular medications for hypertension are lisinopril, amlodipine, hydrochlorothiazide, and losartan, along with sodium bicarbonate for kidney support and calcium acetate with meals. He's also into herbal supplements, including elderberry, echinacea, and ginseng, which he finds help his anxiety, and we're respecting his preference to keep these in his regimen since they don't seem to be interacting with his prescribed meds. Vitals today show a slight fever at 101 degrees Fahrenheit, a blood pressure of 145/85, heart rate of 88, and an oxygen saturation of 93% on room air. He appears anxious but is alert and oriented, with no acute respiratory distress. His breath sounds are clear, and he denies chest pain, though he has a bit of a cough and shortness of breath typical for influenza. We're keeping his oxygen above 92% as needed. He's been quite anxious about being away from his wife and about his overall health, so the plan includes some mental health support, regular check-ins for his anxiety, and staying in touch with his family to keep him more comfortable. Just monitor his vitals and O2 levels, keep him hydrated, and administer Tylenol as needed for fever or pain. Any questions? This is Hector Fernandez, a 62-year-old male with a history of type 2 diabetes, hypertension, heart failure, stage 3 chronic kidney disease, and dyslipidemia. He was admitted due to an exacerbation of his chronic conditions and a stage 2 diabetic ulcer on his left heel. His blood glucose has been poorly controlled, with a recent reading of 278 mmHg and an HbA1c of 10.4%. We're using a sliding scale for insulin management, along with his regular metformin. He's on a carbohydrate-controlled diet, and we're encouraging adherence to help manage his glucose levels. Hector's blood pressure is being controlled with lisinopril, metoprolol, cardizem, and furosemide. His last set of vitals showed a blood pressure of 155/82. A heart rate of 58, respiratory rate of 28. And an oxygen saturation of 96% on room air. He has no active chest pain, but does report occasional shortness of breath with activity, likely due to heart failure. A murmur is also noted. Crackles were noted in the lower lung fields, and he has 3+ pitting edema in both lower extremities. For wound care, We're cleansing his left heel ulcer with hypochlorous acid solution and applying a non-adherent dressing with Curlix twice daily. The wound care nurse asked that we unwrap his wound this morning and leave it for her to dress when she arrives. She plans to see him first. His legs are elevated 3 times a day, and he wears TED hose when awake to manage edema. He's been using acetaminophen PRN for pain, mainly for mild discomfort in the foot area. We're also monitoring his kidney function closely due to his elevated creatinine level of 1.7. Lab results are stable otherwise, with a recent white blood cell count of 10.0 and a hemoglobin of 11.2. His electrolytes are mostly within range, though his potassium is on the low end at 3.4. The plan includes weekly weights, ongoing skin checks, and physical therapy for mobility. He's stable and alert, though he does appear slightly fatigued and anxious at times. His wife is his primary support, and she's involved in his care. Any questions?